the nurses that we have here at Swedish and our caregivers in general. And we are here in our community as a great organization because of the caregivers that work here. So we're glad that we're here at this point with continuing discussions that are going to happen in our negotiations.
Margot, 9 months, why is it taking it so long?
Yeah, we have been bargaining in good faith since April. Certainly the key issues that have been on the table have been wages, benefits, and staffing. We know that we have provided, as part of our package, some of the strongest wages and benefits that are available in healthcare in this region, because we do respect our caregivers and we want to make sure that they are well compensated. And we believe that we have every reason to want to have a competitive package that we're providing. There have been some concerns with some of the things that we've provided, and we've listened to our caregivers. We've heard their concerns and we've adjusted the package that we've provided as we've continued with bargaining. Staffing continues to be an ongoing issue that we're all concerned about. Nursing, I'll speak for nursing, there's a nursing shortage in this country, and we have vacancies in this organization, and we have said all along that we want to work with our union to figure out how we can retain and recruit some of the best staff in the country to our organization. So we want to partner with them with those efforts. How we do that and the details of that is still being negotiated.
Are you relieved at all that this has been put on hold, a potential strike?
Oh, absolutely. We have come to the table every time wanting to resolve this contract, as I've done for years working in this organization. We absolutely want to make sure that we hear the concerns, we come to a fair agreement together, and so any time that you can continue to have the conversations, so we have conversations now scheduled for this next week. Hopefully we will, I'm very optimistic we'll get to a conclusion, a positive conclusion.
How many negotiations have you been through on the side you're on?
The side I'm on as a leader,
right now,
a nurse
yeah,
leader.
You're on the
Right,
hospital
right.
side right now.
3 years ago I was involved in those negotiations. I've been involved in different roles in negotiations over the years.
And is this the closest that you've seen to a strike, or have they struck, or what's different?
I've never in my 40 years been involved in a nursing strike in the organization.
I mean, what would a nursing strike potentially do?
Well, we are committed at Swedish. Again, we do not want to strike. We want to continue to have the conversations and work this through. If a strike were to occur, we are committed to providing the same excellent, high-quality care to our community, and we want the community to know that we have to be prepared that could be an outcome, which we don't want, but if it did, we have to be able to provide that same quality care, which we are prepared to do.
And how would you do that?
Because we will bring in nurses to provide that care alongside our current staff to provide that care for our community.
Okay. And you're already at a shortage of nurses, so I guess if you're already at a shortage and the nurses you currently have struck, how would you be able to swoop in so many replacements to keep that quality care? And if that is the case, that you could swoop in those people, then why wouldn't you? Because one of the complaints was there's not enough nurses, right?
Yes.
You said so yourself, there's not enough nurses. So if there's a shortage and there's a strike, how in the world would we be able to meet those same levels, I guess?
Right. Let me just say that any organization right now, if you look in healthcare, will have vacancies that they need to fill for nurses or other healthcare workers. So we have vacancies, as do other organizations, and we're trying to figure out how we predictively staff and schedule. So that's part of the conversation that we're getting into with SEIU. We have safe staffing in our organization. We are not unsafe. We have very strong staffing, and we provide excellent outcomes. And one of the examples of how we provide excellent outcomes is organizations are actually evaluated by our quality outcomes and our patient outcomes by Centers for Medicare and Medicaid. We recently, this past year, were evaluated, and 4 out of our 5 hospitals received 5-star ratings from CMS. That means we're in the top 8th percentile of the country. We have great outcomes, we provide great care, and we have good staffing. Do I want to fill all of our vacancies? Absolutely. So that we're not using agency nurses, which we're doing now currently, to backfill some of those open positions. And we will just expand that if we need to do that in the event of a strike, which again, we would like to avoid and work with our SEIU partners to kind of come to an agreement.
How are you feeling going into this week?
I'm optimistic. I'm very optimistic that we've had this conversation that happened in the last 24 hours and have reached, and we've adjusted some of our proposal to address some of the concerns, and we'll move forward in those conversations this
What
week.
were the major adjustment points on your end?
I can't speak to all the specifics. I think I don't have that document in front of me, but there were pieces that they were interested in hearing about that we said we would be open to having conversations. So those conversations are going to continue to be solidified in this next week, but it was enough movement that we all felt that we could move forward this next week.
Thank you very much.
Thank you.
Thank you.
Out of the way.